Hello everyone, my name is Woong, who is corresponding author in this article. First author is Kwang Kim at Ewha Women's University Hospital. The title of this article is Prolyl hydroxylase 3 is a novel renal cell carcinoma biomarker. There are several biomarker studies in renal cell carcinoma. New thing is that we investigated a comparatively large number of patients including renal masses. In a nutshell, the result of the present study revealed that PHD3 levels are significantly higher in RCC patients than in healthy and cancer-free individuals. PHD3 levels did not differ by age, sex, or regardless of benign renal masses. In addition, correlation of PHD3 level with the tumor size, stage, and grade were observed, indicating that this marker can potentially reflect tumor burden or aggressiveness. The hypoxia-inducible factor HIF pathway plays an important role in development of RCC. It is a key regulator of pathogenesis in RCC. PHD are also closely related to HIF signaling, which is critical in hypoxic condition of the tumor microenvironment. Under normoxic conditions, PHD inactivate HIF through hydroxylation of a specific domain, and it plays a role in HIF degradation process. A previous transcriptional study shows that PHD3 expression is highly unregulated in RCC tissue compared with that in normal kidney tissue. It suggested that PHD3 might be a biomarker of this disease. Between October 2013 and March 2015, we prospectively recruited patients after obtaining approval from IRB. The RCC group consisted of 56 patients who underwent radical or partial nephrectomy. The control group is 56 healthy kidney donor and 13 patients with benign renal masses. Blood was sampled just before the operations and the first and third months post-operatively. Table 1 shows the characteristics of this study cohort. Patients in the RCC group were significantly older than the controls. However, the PHD3 levels did not differ according to the age. 76.8% had T1A disease, and 78.6% had a clear cell histology in RCC. If you closely look at Table 2, non-significant trend of higher PHD3 level were observed in patients with larger size, higher grade, and T2 stage tumors. This figure shows that RCC patients had higher serum PHD3 levels than the controls. Analysis of ROC curves for all 56 RCC cases versus all 69 controls reveals an AUC for PHD3 of 0.668. Using a cutoff value of 0.761 nanogram per milliliter, sensitivity was 66.1%. Specificity was 68.1%. Positive predictive value was 28.8%. And negative predictive value was 37.3%. The diagnostic performance of PHD3 was improved when considering only those patients with tumor size above 2 cm. Figure 2 shows that the mean PHD3 level in the RCC patient at post-operative first month and third month has decreased from the pre-operative levels. For the 37 patients with PHD3 levels greater than the cutoff value of 0.761 nanogram per milliliter, the level was decreased in 89.2% at first postoperative month, and in 31 patients, 83.8% at third postoperative month. The result of the present study revealed that PHD3 levels are significantly higher in RCC patients than in healthy and cancer-free individuals. The diagnostic performance of PHD3 was improved when considering only those patients with tumor size above 2 cm. We suggested that measurement of the PHD3 levels will yield superior diagnostic accuracy in significant RCC. Our study has several advantages over prior studies. First, our study included patients with benign renal masses in the control groups, and we demonstrated that PHD3 could be utilized for differentiation between malignant and benign renal masses. Second, the current study included more than twice the number of patients compared with the previous study. Third, we also investigated the association between PHD3 and age, sex, and the tumor characteristics, such as mass size, stage, and histology. In conclusion, serum PHD3 level can serve as a novel biomarker of RCC diagnosis and post-surgical monitoring, and it shows acceptable diagnostic performance. It can also help differentiate RCC from benign renal masses. Serum PHD3 appears to be suitable for clinical application in RCC patients. Thank you.